Camera is on, recording is on. Let's begin. Okay, we have finished everything previously, right? There aren't any left over. We have finished the entire scheme. Okay, let's talk about endocrine system. Endocrine system consists of the following organs, and the two organs missing here are your ovaries and testes, because they're also considered to be an endocrine organs because they do make testosterone, right, and estrogen and progesterone. So they are considered to be endocrine as well. Now, what is the master of everything? Of course, the hypothalamus. This part I'm not covering because we talked about it, remember, right? The major difference between endocrine and exocrine. Exocrine do have a duct system. Endocrine always surrounds a blood vessel and puts its product directly into the blood vessel. The organ, like the gland that is controlled, the master gland for everything, is definitely your hypothalamus, right? So hypothalamus is like your commander, somebody who tells all other endocrine organs what to do. So this is why the hormones that hypothalamus makes are always called releasing hormones, because they're allowing your other endocrine organs to act. Who does hypothalamus typically acts on? Pituitary gland. It's its little helper, okay? Pituitary is its little helper. You can see the amount of hormones it makes. It also makes lots and lots of hormones. And pituitary will also be affecting all other endocrine organs as well. So one of the major one, the one that controls everything, is hypothalamus. But through what does hypothalamus controls? It controls through the pituitary gland, right? So hypothalamus and pituitary are always next to each other. You always see them within proximity from one another. What do they make, endocrine organs? Of course, they make hormones, and hormones generally are subdivided into the three classes: steroids, peptides, and amines. Steroids, those are the lipid hormones, right? So steroids, those are the lipid hormones. They consist of cholesterol ring, so they're very steroidal. Like, for example, your estrogen, testosterone, aldosterone, and cortisol. Peptides, those are like protein-like. Majority of the hormones of your pituitary glands, they are peptides. And amines, they have the amine group. So like from tyrosine, typically this amine group comes from. This is your thyroid hormones, epinephrine and norepinephrine. Do not forget that hormones, how do they affect the tissue? They bind to their specific receptor. So in order for your target organ to be affected by a hormone, it has to express receptors for that said hormones, right? Let's talk about pituitary gland. Pituitary gland is also known as the hypophysis. And we have two hypophyses. We have the anterior and posterior lobes of the pituitary gland. Anterior is called adenohypophysis, posterior is called neurohypophysis. As you can see, adeno means glandular tissue. It's a very famous question by Professor Antol. He always asks, what does it mean, adenohypophysis? It means that its consistency is glandular. Neurohypophysis is neuro. Agree with me, those two tissues are not the same. So that means that they have to come from different places, and we will talk about it, that your one pituitary gland, right? So one pituitary gland, where do I have the picture? Here it is. Your one pituitary gland, it has two lobes, right? It has the anterior lobe and has the posterior lobe, and they have different consistencies. They do not come from the same thing, right? So they're not going to come from the same thing. So pituitary gland is attached to hypothalamus, but which lobe? The posterior lobe specifically. So your neurohypophysis, your posterior pituitary, will be attached to the hypothalamus through a structure which is called a stalk, connecting stalk, or another name, infundibulum. Okay, so there is a connection of some sort, right? Connection of some sort, which we call infundibulum. Where is the location of your sella turcica specifically? Where is the location of your pituitary gland specifically? It is within the sella turcica, okay? So it is within the sella turcica. So this little tiny Turkish saddle, you probably saw it in the skull as well. That's the place, like a depression where the pituitary gland is sitting, right? So that's the sella turcica right here. Weight, it's different in males and females. In males, it's only 0.5 gram. In females who have given several births or were pregnant several times, you see that the pituitary gland is bigger. You will see why. So in multiparous females, it's definitely 1.5 grams. So let's talk about the different origin, right? The embryology of your pituitary gland. Again, another name for anterior lobe of the pituitary, we call it adenohypophysis, right? Adeno, it's glandular. Another name for posterior, we call it neuro, it's neuro. So here is your neuroectoderm. So yellow is neural ectoderm. Salmon pink is your oral ectoderm, specifically the roof of your oral cavity, right? So the oral ectoderm. You can see that your neural ectoderm makes a deepening of some sort. And we say this is the down growth of the diencephalon. Next semester in embryology, we will learn what is diencephalon, but diencephalon is the part of the primitive embryological brain that gives rise to your thalamus and hypothalamus. So we could say that this area here is the diencephalon. It is your future hypothalamus, right? That's the area for your future hypothalamus. So this diencephalon forms the downgrowth. And you can imagine that this downgrowth will be your neurohypophysis. It will be your posterior lobe. What about the adenohypophysis? Adenohypophysis, or glandular or anterior lobe of the pituitary gland, forms from the upgrowth of the oral ectoderm. And this upgrowth is called a Rathke's pouch. Whenever you hear this word, Rathke's pouch, you're always thinking about anterior or adenohypophysis. That's what you're thinking about. I repeat, Rathke's pouch is this upgrowth of the oral ectoderm. And I mean, you don't need to know embryology. You can understand that neural ectoderm and oral ectoderm are not the same thing. They're not the same thing. So the reason why adenohypophysis is so weird, it's so glandular, because its origin is not neurohypophysis, right? It's not neuroectoderm. Its origin is oral ectoderm. So we call it as the Rathke's pouch. Okay, so here we have two lobes, posterior pituitary, connected to your hypothalamus because they come from the same thing. They come from the neuroectoderm. Where does your adenohypophysis come from?
Oral ectoderm.
Rathke's pouch will be more correct. Okay, so your anterior pituitary, your adenohypophysis will come from the Rathke's pouch. What is Rathke's pouch? It is the upgrowth of the oral ectoderm. So generally, yes, it comes from the oral ectoderm, but more specifically, it comes from the upgrowth of the oral ectoderm, which we call the Rathke's pouch. Okay, what do you need to know? Anterior pituitary makes the hormones by itself. So this area makes the hormones itself, secretes it, and etc. Posterior pituitary does not make the hormones. It simply stores them. Posterior or neurohypophysis is simply the area where you store the hormones. So who will be making them? Well, who is your posterior pituitary connected to?
Hypothalamus.
Hypothalamus. So who will be making the hormones? Hypothalamus. The hormones which are stored within the posterior pituitary are made by the hypothalamus. Hypothalamus makes those hormones. Which nuclei make them? We call them paraventricular, supraoptic, and arcuate nuclei. What is nucleus? Nucleus is just a bunch of neurons together in the central nervous system. So a bunch of neurons together, specifically in the central nervous system, we call it nucleus. So within your hypothalamus, you have here nuclei. And how do we call those nuclei? We call them paraventricular, supraoptic, or arcuate. And they are the ones which will be making some sort of hormones we will see right now, and those hormones will be transported to the posterior pituitary and will be stored here. Is it clear?
Mm.
How do we call those nuclei together? Sorry, without the arcuate. Sorry. So just paraventricular and supraoptic together. How do we call it? We call it magnocellular nuclei. It's a very unfair question to ask because we will learn it next semester in neurohistology, but still they could. Okay, so those paraventricular and supraoptic nuclei together, they're called magnocellular. So sometimes in your self-control, you will not be able to see those. You will just see the hormones which are stored in the posterior pituitary are made by the magnocellular nuclei. Correct, that's a correct statement. Okay, so magnocellular nuclei, which are sitting in the hypothalamus, are making the hormones which are stored in the posterior pituitary. Is it clear?
Yes.
So to kind of hit the point home, anterior pituitary, I make the hormones myself, I store them in me, and I release them. Posterior pituitary, somebody else makes the hormones, I simply store them. Those are the anatomy, so the most important parts. So here we have adenohypophysis and neurohypophysis. What's another name for adeno? It is anterior, right? This is the anterior lobe of the pituitary. This is the neurohypophysis, so it is posterior. As you can see, your neurohypophysis is connected to the hypothalamus, right? You can see that there is a connection to the hypothalamus. How do we call this connection? This is known as the infundibulum. Okay, so infundibulum or connecting stalk, that's the area which will be connecting your posterior lobe of the pituitary to the hypothalamus. Remind me which nuclei I sit in here within the hypothalamus?
Magnocellular nuclei.
Very good, you could say this. So here we have magnocellular together. They are called magnocellular nuclei, but how do you say specifically?
Paraventricular, supraoptic, and arcuate.
They draw two of them for a reason. Why two of them? Because those two are specifically the supraoptic and paraventricular. So here we have supraoptic and paraventricular nuclei. They are neurons. Their axons are traveling down, 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 down to the posterior lobe, where they will drop the hormones that they're making. Okay, where they will drop the hormones that they're making. Okay, how do we call in Latin the area right here? This is known as the pars nervosa. So the entire area of your neurohypophysis in Latin, it has a name. It's called pars nervosa. So just entire posterior neurohypophysis. Now, your adenohypophysis has three areas. The bulk of it, the one which makes majority, not majority, all of the hormones, this is known as the pars distalis. So the bulk, the entire area of the adenohypophysis, in Latin, pars distalis. The area between them, okay, so the area between them, so between the adenohypophysis and the neurohypophysis, this is known as the pars intermedia. Still, pars intermedia is part of the adenohypophysis. Okay, it's not like a separate area, it is belonging to the adenohypophysis. Pars tuberalis is a part of the adenohypophysis that surrounds the infundibulum. So that's the area which kind of surrounds the infundibulum. So in Latin, two areas are making up neurohypophysis. What are those areas? Pars nervosa and infundibulum. In Latin, three areas are making up adenohypophysis. What are they? Pars distalis, pars intermedia, and pars tuberalis. Is it clear?
Yeah.
Okay.
Yeah.
So let's talk about adenohypophysis and neurohypophysis a bit more specific. So that's what we talked about: pars distalis, pars intermedia, pars tuberalis, right? Those are the three areas of the anterior lobe. Posterior lobe is going to consist of the pars nervosa and infundibulum. Now, this is very important, okay? So I will show it on this slide. So here is your hypothalamus, right? You can see that there is a part of it which directly connects to the posterior pituitary, to the neurohypophysis. How do we call this area? Infundibulum, or connecting stalk, right? And then behind it, we can see the anterior lobe just hanging. So what do you need to know? Your pituitary gland has two blood vessels that supply it, two arteries. The first one is called superior hypophyseal artery. The second vessel is called inferior hypophyseal artery. So the two arteries supply your pituitary gland, superior hypophyseal and inferior hypophyseal. On this picture alone, you can see that inferior hypophyseal artery supplies which lobe specifically?
Here.
Posterior lobe specifically. What about your superior hypophyseal lobe artery? What does it supply? Does it supply any lobes?
No.
No, it supplies the infundibulum. And how do we call the area behind the infundibulum?
Pars tuberalis.
Tuberalis.
Very good. Pars tuberalis, right? So that's the area that it supplies. So here it supplies the infundibulum and pars tuberalis. So which lobe does not have direct arterial supply?
Anterior.
Anterior lobe. This is very important. Anterior lobe, adenohypophysis, does not have the direct arterial supply. That's it. I don't know how to finish. So it does not have arterial supply. That's it. So a question for you. If hypothalamus wants to control posterior pituitary, right, it can do so directly because they're connected, right? So just send an axon to the posterior pituitary, control it, and that's it. But how can hypothalamus control anterior pituitary? Well, it can't, because neuron cannot go to the epithelial cells, right? Here, adenohypophysis is a glandular tissue. It consists of epithelial cells. So how can it control? Only through hormones. So hypothalamus will have to make a hormone that tells pituitary, specifically anterior pituitary, what to do. Let's do it a bit more specific. Anterior pituitary makes a hormone which is called thyroid stimulating hormone. And for sure you have saw it before, right? TSH, thyroid stimulating hormone. What will this hormone do? It will stimulate your thyroid gland to release its product. But what tells your thyroid gland to do, what tells your pituitary gland to release TSH? The hypothalamus. And how do you call the hormone that tells so? This hormone is called thyroid releasing hormone, right? TRH has to come from the hypothalamus, reach your anterior lobe of pituitary, so your anterior lobe of pituitary can make TSH. And where will this TSH go? It will go outside of your anterior pituitary all the way to the thyroid gland to stimulate your thyroid gland to make the hormone. My question to you is, how does TRH reach your anterior pituitary gland? How does it reach it? What do you need?
Blood supply.
You need blood. You need a blood vessel. Here we have a blood vessel called superior hypophyseal artery. So what does your hypothalamus do? It puts its TRH into the superior hypophyseal artery. Perfect. Let's imagine that those vessels are not here. They are not here. So what does this artery becomes? It becomes superior hypophyseal vein, which is going away. So does your TRH reach the area? Absolutely not. Luckily, we extend our venous system. We introduce something which is called primary capillary plexus. Okay, here it is. This is the primary capillary plexus. And the secondary capillary plexus as well. There are two capillary plexuses. For sure, from last semester, you remember. How is it normally? Artery, capillary, vein, correct? There isn't two capillaries. There's just one capillary that connects the arterial and venous system, right? But here we can see that there are two capillary systems. For which reason? To kind of extend your venous system just a little bit more. How do you call the vessel that connects the two capillary systems? This vessel is called portal vein. Guys, this is such an important question in anatomy specifically. They'll always ask you, what is a portal vein? What is it? Portal vein is a vein that connects two capillary beds. So take a look at this picture. This is how it normally should be, right? So your artery becomes capillary, capillary will become the vein, right? But can we do it how it is in the pituitary? So what happens? Arteries become first capillary bed, right? It becomes first, it becomes primary capillary bed. What is the next vessel? From the primary capillary bed, where do you go?
Portal vein.
Portal vein. You go to the portal vein. From the portal vein, you go to the secondary capillary bed, right? So you go to the secondary capillary bed. And from the secondary capillary bed, you go to the vein. You go to the final vein. So do you see what we have done? We have kind of elongated our system a little bit. We made it longer. If we made it longer, we can cover more area. So your anterior lobe has no direct blood supply. You can see that superior hypophyseal artery is not reaching it. It cannot. So what's the only way to reach the anterior lobe for nutrients, for hormone-wise? You have to extend your venous system. How can you extend your venous system? You introduce two capillary beds. Where is the primary capillary bed? It is at the level of infundibulum. Where is the secondary capillary bed? It is at the level of the anterior lobe itself, right? So now if your hypothalamus wants to release TRH, how will TRH travel? It will first go to the superior hypophyseal artery, then primary capillary net plexus, then portal vein, then secondary capillary plexus. It reaches your anterior lobe. So anterior lobe is like, okay, I need to release something. What do I need to release? Well, TRH, it tells you release thyroid hormone. So pituitary gland will really release thyroid hormone, TSH. Where does it put its TSH? Back into the secondary capillary plexus, and from there it goes through the vein to your thyroid gland. So is it clear what is the purpose of the portal vein? Can somebody tell me, why do we introduce the portal vein? Why is it important that it is here?
To connect to beds, capillary beds.
Very good. You can even say better without you using the beds, because then I can ask you, why do I have the two beds? Why do I have two beds? Because normally I only have one capillary bed. Here I have two capillary beds. Why?
Because the anterior pituitary doesn't have its own blood supply.
Amazing. Because anterior lobe does not have its own blood supply. So I need to extend whatever supply there is. I need to just make it a bit longer. So that's why I introduced the second capillary bed. That's why I connect the two capillary beds with the portal vein, right? So that's why I make this system longer. Okay, so forever and ever in your anatomy as well, your portal vein is the vessel that connects the two capillary beds. Okay.
Yulia, what is median eminence?
We'll talk about it.
Okay.
I'll tell you right now. Yeah. I'll tell you right now. Actually, let's talk about now. Hypothalamus connects to the posterior pituitary gland through infundibulum. But what connects hypothalamus to the infundibulum? Median eminence. So what's the exact connection? Hypothalamus connected to the median eminence. which is connected to the infundibulum, which is connected to the posterior lobe. That's the pathway. Just connections. Okay, this is what we have talked about it. I could not stress, I cannot stress enough how well you have to understand this. It is always tested. Okay, oral, SAT, you can expect question from here that the primary, secondary capillary beds, where are they located, what connects them, what's the purpose. So I hope that was clear. So anterior lobe, here, because it is endocrine organ, right, we have fenestrated capillaries. Do you remember this from last semester, right? Discontinuous are in the spleen, bone marrow, right, liver, etc. Fenestrated are going to be always present within endocrine organs. Okay, what are the hormones that your anterior lobe is making? Adrenocorticotropic, it's going to be reacting, it's going to be working on the cortex of adrenal gland. Thyroid stimulating on the thyroid, follicle stimulating and luteinizing hormone on the your gonads, right, on the testes and on the ovaries, it works, both of those hormones. And then you have the growth hormone and prolactin. And we call growth hormone and prolactin as a non-tropic hormones. We call them non-tropic hormones. Those four are considered to be tropic hormones. Those two are non-tropic hormones. What does it mean? Tropic means that you are acting on another endocrine gland. That's what tropic means. So take a look at your FSH. What is it acting on ovary or testes? Ovaries and testes are endocrine organs. So if is FSH tropic? Absolutely. What about your growth hormone? What is it working on? Your liver, your bones, your cells in general, are they endocrine? Not so much. So your growth hormone is not endocrine. What is your prolactin working on? On your mammary gland? Is your mammary gland endocrine organ? No, so it's non-tropic hormone. Where do we have cells that make those hormones? In the pars distalis, right? So that's the major part of the anterior pituitary gland, pars distalis. That's the place where we make those hormones. Who makes those hormones? Cells. There are three types of cells within the pars distalis: chromophobes, acidophil, and basophil. Acidophil and basophil are considered to be chromophils because they have a color, either acidophilic or basophilic. Chromophobes do not have a color. We have 6 hormones, right? Who makes those 6 hormones? Either acidophils or basophils. Chromophobes are stem cells. They are not making hormones. They're giving rise to acidophil or basophil. So chromophobe does not make hormone. It gives rise to another cell which will give you hormone. So acidophil and basophil, they make the hormones. So for example, you can see here that, for example, growth hormone cells, they are acidophils. Prolactin cells, they are acidophils. Adrenocorticotropic cells, they are basophil, right? FSH, LH cells, they are basophils. TSH cells, they're basophils. So you can see that there is no chromophobe, right? So the cells that make those hormones, they are not chromophobes, because I repeat, chromophobes are stem cells. They're not making hormones, okay? They're not making hormones. Okay, it's a very easy question to ask. And for example, 2 years ago, they did do that. So I'm not sure about if they're gonna do it again this semester. So they just said lactotrope is acidophil, which makes prolactin. And that was a correct sentence. It's a giveaway sentence. It's very easy, right? So lactotrope is a specific cell. What does it make? It makes prolactin. Which kind of cell is it? Is it acidophil or basophil? Well, it is the acidophil. It's a giveaway. So just learn the cells which make the hormone. How do you call them, right? The cells that make growth hormone, we call them somatotropes. And somatotropes are acidophils as well. Pars intermedia. This is a remnant area. In frogs, they make melanocyte stimulating hormone. So that's why frogs can change their color, the skin of the color. We humans can't, so our pars intermedia does not have it. Okay, so the basophils here, they make melanocyte stimulating hormone, but not as much as in the frogs. Okay, so just this part. In our slide, within this area, we have a remnant, and this remnant is known as the Raffke's pouch, Raffke's cyst. It is a remnant of the Raffke's pouch. I will show it to you. And you remember that Raffke's pouch is the oral ectoderm, right? The upgrowth of the oral ectoderm that gives you the entire adenohypophysis. Pars tuberalis, nothing interesting. It's just the area which kind of surrounds the infundibulum, right? So highly vascular system, highly vascular region, because that's the place where you have the primary capillary bed, right? So here is the primary capillary bed going to be. Posterior lobe, do not forget, it only stores and releases. It does not make the hormones, right? It doesn't make the hormones. It has two areas. It has pars nervosa and infundibulum. Who makes the hormones? Paraventricular and supraoptic nuclei within the hypothalamus, right? So paraventricular and supraoptic nuclei in the hypothalamus, they will be making the hormones. Which hormones? Oxytocin and ADH. Another name for ADH is vasopressin. Okay, so oxytocin and ADH. Let me remember. Let me check quickly so I don't lie. Because it's in neuro, and I remember there was a question like this. Basically, you see two hormones. So the two nuclei, they will not be making the same hormone. It's a very unfair question to ask, but they could ask you, okay? So let me just check it so I am correct. So the supraoptic, as far as I remember, makes ADH, but I might be wrong. Supraoptic nucleus function, yes, it makes ADH. Yes. So supraoptic nucleus makes ADH specifically. The paraventricular is making oxytocin. So the two nuclei are not making the same hormones. Supraoptic is making ADH, and the paraventricular is making oxytocin. Oxytocin, as you remember, this is the hormone responsible for the contraction of the smooth muscle. So it's super active during delivery, right? So when your uterus is contracting to push out the baby, that's when oxytocin is there. ADH stands for antidiuretic hormone, right? So it does not allow you to pee. So on the opposite, it makes you store and kind of concentrate the water in your body. So yeah. Now, where do we store ADH and oxytocin? In something which is called Herring's body. So again, here we have paraventricular nucleus and supraoptic. What is a nucleus? It is a collection of a neuron. But which part of a neuron? Cell bodies of the neuron. Do you know how to draw the neuron? For sure, you have seen it. There is the cell body. What comes out from the cell body? Dendrites. And what is coming out this way?
Axon.
Axon. Very good. So a bunch of those, a bunch of cell bodies, it's called nucleus. So you have a paraventricular nucleus, it's just a bunch of cell bodies of a neuron. You have a supraoptic, it's just a bunch of related functionally cell bodies of neurons as well. Always they ask this question, what is within the infundibulum? What is inside of it? What is in the infundibulum? Axons, a bunch of axons. Whose axons? The paraventricular and supraoptic neurons. At the bottom of this axon, there is a dilation, like a cytoplasmic dilation. This dilation is called Herring's body. And what is inside of this Herring's body? Well, it depends. If you're coming from supraoptic, what is in this Herring's body? ADH. Yes. If you're coming from paraventricular, what is in that Herring's body? Oxytocin. Okay, so a Herring's body do not contain and, they contain or. So it's either oxytocin or ADH, depending on where you come from. But what is Herring's body? Is simply a dilation. It's like an end dilation of a neuron. So it is right here, right? So this is the axon of my neuron. So here I will have lots and lots of dilations of those neurons, which store those hormones, right? Which are going to be storing those hormones. In addition to those cells, we will also have supporting cells of the neurohypophysis. They are called pituocytes. Pituocyte, I repeat, is a glial cell. Glial cell means supporting. So they just surround your neurons and stay there. So let's do our slide. So this is your pituitary gland. As you can see immediately, one lobe looks different than the rest of the tissue. So what is this one lobe?
Anterior lobe.
Very good. This is the anterior lobe or adenohypophysis. What is its origin?
Oral.
Oral ectoderm. Oral ectoderm. How do you call the upgrowth from which it came?
Red-shaped.
Raffke's pouch. Right?
Pouch.
So Raffke's pouch. Very good. What is this? Infundibulum. This is the connection. This is the connection. What is in the infundibulum?
Axons.
Axons of the previous nuclei of the paraventricular and supraoptic. This is your neurohypophysis, right? So which contains the storage. This is a vein, and this is going to be inferior hypophyseal vein. So this area right here, it's a huge vein. This is the inferior hypophyseal vein. Now this tissue right here, this is a dense connective tissue. You can see it here, right? So this is a dense connective tissue. This is meninges. This is dura mater, arachnoid, and pia mater together. So this is like a piece of covering of the brain. So this is the dura mater with the rest of them. Okay, let's do the numbers. So 1 in Latin. How would you area?
Pars distalis.
Distalis, amazing. Okay, so this area right here, this is going to be pars distalis. This is pars distalis. What about free?
Pars intermediate.
Pars intermedia. Okay, 2 years ago, they did a very unfair thing. They pointed here. This is also pars intermedia. Do you see the color is the same? Okay, so this area right here, this is also pars intermedia, because the color is much similar to the area here. They're the same. 2. Inferior hypophyseal vein. Okay, so this is the inferior hypophyseal vein. 6.
Pars nervosa.
Pars nervosa, right? This is the pars nervosa, because pars distalis is 1, right? So this is the bulk of the adenohypophysis. 6 is going to be pars nervosa, which is the bulk of the neurohypophysis. 7. Dura mater, I don't know, meninges, whatever. 5, we talked about it, infundibulum. 4.
Pars
tuberalis. Yes, okay, so this is going to be known as the pars tuberalis. So this area right here, this is known as the pars tuberalis. Now, before we go, do you see there is this area? It's looking very weird. This is the remnant of the Raffke's pouch, this. And this is called a Raffke's cyst. So this colloidal looking structure, this is the Raffke's cyst. So Raffke's cyst is the remnant of the Raffke's pouch. Fun fact, some people are prone to headaches. They get headaches like regularly, assuming that they are hydrated. They're very well hydrated. They do drink water like minimum 2 liters. If they still have those headaches, that means that their Raffke's cyst is bigger than usual. It's bigger than 0.5 centimeters. So it's very interesting study was made that those people who are prone to headaches, their Raffke's cyst is a bit bigger. Okay, we're in the pars distalis. We're here. Okay, we're in the pars distalis. What are those? Those are blood vessels. Which kind of blood vessels are those? Fenestrated capillaries. Amazing. So we're in the pars distalis. You can see that there are lots and lots of blood vessels. Those are going to be fenestrated capillaries. Yes, all of those, because we're in the endocrine tissue. We magnify a little bit, and this is what we see. So this is your fenestrated capillary. You can see some blood cells inside of it, right? So penetrating capillary is here. You can see that some cells have no color. Some cells are red and some cells are blue. So how do you call the cells with no color?
Homophobia.
Chromophobes, right? They're afraid of a color. So those are the chromophobes. How many of them? About 50%. So you can see half of the cells here, they do not have any color. Take a look how many of them, right? So no color, chromophobes. What about those cells here? Acidophils, okay? They are about 40%. And this one? Basophil, is about 10%. Which of the three of them actually makes a hormone?
Acidophil
and basophil, yes. Acidophil and basophil. Together you call them chromophil, right? Because they do like color, because they do make. Chromophobes, what is their job?
Stem cells.
They're stem cells. They're responsible for giving rise to those cells, right? Different types of acidophils. Here you go, right? Somatotropes, lactotropes. Different types of basophils, corticotropes, gonadotropes, phylotropes. Okay, so this is the inferior hypophyseal vein, and this is some additional veins and arteries, and this is the Rafkes cyst. So this colloidal structure, this is a Rafkes cyst. Okay, everybody knows what colloid is, right? It's like a milky substance. It's not transparent. So it's very thick, very milky substance. So this is your Rafkes cyst right here. This is the remnant of the Rafkes pouch. This is your pars nervosa. Okay, so nothing interesting, just the cells with a bigger nucleus. Those are going to be your pituocyte. Pituocyte is a supporting cell. Okay, so pituocyte is a supporting cell. So the same for you, just mark it when you need to. This is a herring's body. I could not find one. Okay, so in the pars nervosa, in this area, in here, you need to find something like this. And they did find, I just cannot understand in which area is it. I scrolled through the entire pars nervosa, I couldn't find which one they pointed out to, but that's how it looks like. Okay, so that's exactly how it should look like. So those are the dilations of the ends of the paraventricular or supraoptic nuclei, right? Neurons, and they contain either ADH or oxytocin, right? So one of them will contain. So that's how it looks like. And that's the picture from the internet of how acidophil and basophil should look like. Okay, so basophil, acidophil, and chromophone. That's how they should look like. Immediately when you look at the slide, a very, very prominent color is blue. Okay, so what is the staining? You can see some red nuclei, some blue things, so azan. What is the purpose for it? To show you blood vessels. So you're looking at the pars distalis, you're looking at the adenohypophysis, and you can clearly see blood vessels. You can see how many of them are there, okay? Just remember that those blood vessels are fenestrated. They have fenestra. Remember how big are the fenestra?
The size of a red blood cell?
If the red blood cell was the size, then all the red blood cells would go out. All of them would go out from the fenestra, and that's it.
60.
Oh yeah, like amazing, man, amazing. So another free class. So what can I do? If you're answering such questions, what can I do? So it's about 60 kilodaltons, okay? So this is the 60 kilodalton. It is the size of the albumin, okay? So it is the size of the albumin. So yeah, congrats, way to go. Another free class. So pineal gland, another name epiphysis, and it is on the opposite end. So here is your pituitary. Here's your pineal on the opposite end. So here is your hypothalamus with the pituitary gland. Pineal is opposite end. Considered to be part of the epithalamus, weighs about 200 milligrams. 2 cells, pinealocytes, interstitial glial cells. What do pinealocytes make? They make a very important hormone. which I cannot sleep absolutely without. I have to take it. If I don't, I won't sleep. Melatonin. Okay, so pinealocytes, they make melatonin. That's the hormone that forces you to sleep, right? So if you take it, you will go to sleep. When I was a second year medical student, we had a guy in my group that I used to study with. His pineal gland was atrophied. So he had a medical condition where his pineal gland was very small. So as a result, his amount of melatonin was very small. So he wouldn't go to sleep. And I remember I was studying with him for the exam period for anatomy. We were studying together. And this guy would not sleep for 2-3 days. So he wouldn't just take his pills. He was prescribed melatonin pills in order to go to sleep because his pineal gland is not there. It's not working properly, right? So for exam period, he wouldn't take them. For 2-3 days, he wouldn't sleep. And you should see that, like, that's what, after we passed our exams, I was like, listen, never, ever, ever am I studying with you again, because it's impossible. Like, he's so hyperactive. Like, you want to go to sleep and you just want to, like, I don't know, relax and forget about it. But, you know, you're active, you're crazy. And he told me, I'm not sure if it's true, but he told me the longest he ever went was 6 days. And on the 6th day, hallucination starts to appear, that you start to see things which are not there because you do need sleep. So melatonin is amazing hormone that forces you to go to sleep. And another fun fact, which you're probably all aware of it, what cancels production of melatonin? Light, right? So light. So that's why retinal hypothalamic tract is the one which will be inhibiting, right? It's a very sensitive tract that comes from retina. If you have light stimulation, no melatonin production. So that's why when you go to sleep, don't look at your phone, because literally you won't sleep. You will not sleep because the more you look at your phone, the more light passes to your retina, the less melatonin you make, or at least put it in the night shift mode, right? That it gives you this yellow light, not the blue light. So that's also important. Calcium precipitation. There is a calcium that likes to accumulate in the pineal gland. We call it corpora arenacea. That's in Latin. Okay. And fun fact, elder people have a very weird circadian rhythm. They go to sleep at like 6, wake up at like 2 a.m. Okay. Why is that? Because the more older you get, the more calcium precipitates in your pineal gland. So your circadian rhythm shifts completely. Okay, so it's not there. So this is how the pineal sites should look like. And this is the astrocyte, which is the glial cell which simply supports it. So here's your pineal gland. So this is your pineal gland. This is your pineal gland. This is brain. This is epithalamus. So this tissue, this is the brain tissue, which is the epithalamus itself. Even with this magnification, you can see that there is some kind of precipitation within the pineal gland. What is this precipitation? This is the corpora arenacea, right? So this is the corpora arenacea, the brain sand. So there you go, corpora arenacea, calcium phosphate precipitation. What are those? Those are going to be pinealocytes. Those are the cells which make melatonin in the absence of light. So you do go to sleep. You're induced to sleep. Those are the glial cells or astrocytes. They simply support your pinealocytes. They give it functional, I don't know, structural, nutritional, emotional support. Okay, so to make sure that your pinealocytes are all right. Thyroid gland, okay, so that's the place where it is located. So it is a bilobed endocrine gland located in the anterior neck region. Typically has 2 large lateral lobes, which are connected by isthmus, right? So this area, this is the isthmus right here. But in your anatomy, you should know that sometimes there are some people which have 3rd lobe, which is going upwards like this. And this 3rd lobe is called pyramidal lobe. In the anatomy, have you learned it? Have you covered thyroid or not yet? Have you covered thyroid gland in your anatomy or no?
No.
That's a yes or no kind of question. So I think no. Okay, so definitely not. So you shouldn't have yet. Have you?
No.
Because I feel like you're still But at the same time,
No.
you're doing the neck structures.
We saw it on the ID, but we
Larynx,
didn't.
larynx.
Structure, the location is done.
But we didn't do thyroid gland.
You should, because it's like a topic. So a thyroid gland, it has two lobes, isthmus that connects it, and the pyramidal lobe, which is kind of protruding from it, right? So not every person has it. So not everybody has it. So just some people have it. We'll talk about it in embryo, why. Okay, grams, whatever, pyramidal lobe. Okay, that's very important. What is the functional unit? The functional unit is a follicle. So your thyroid gland will consist of follicles. This is embryology. We'll cover this in embryo. What is the embryo of the thyroid gland? Okay, this is also the embryo of the thyroid gland. So that's the thyroid follicles. That's how the thyroid gland looks like. It has lots and lots of follicles. There are two types of cells in the thyroid gland, follicular cells and parafollicular cells. Follicular cells are the cells which surround the follicle. Okay, they're the ones which surround the follicle. And what do? They make T3 and T4, right? So triiodothyronine and tetraiodothyronine, or another name, thyroxine. So I wrote it somewhere here. So there you go. So triiodothyronine is T3, tetraiodothyronine is T4, another name for T4 is thyroxine. So T3, T4 are made by follicular cells. They're here. And they use something from the colloid. So colloid is this substance within the follicle. They use this colloid to make T3, T4. We'll talk about it. Between the follicles, we have parafollicular cells. We call it C cells. C cells make calcitonin. And you need to remember that parafollicular cells belong to a family of cells, and those family of cells are called APUT. We talk about APUT more next self-control test, but we start talking about it right now. APUT stands for amine precursor uptake and decarboxylation. So this is a whole family of cells. Lots of cells belong to this family. APUT cell cannot be seen with H and E. Okay, so APUT cells, like your parafollicular cells, for example, you cannot simply stain with H and E and they will be seen. No. APUT family cells can only be seen with silver impregnation. So only by using silver impregnation can you see APUT family. Additional fact, APUT family have one thing in common, one thing. They all came from neural crest cells. Well, assuming they make hormones, because you have to make hormones, okay? You have to make hormone to be considered APUT family. So assuming you make hormones and you come from neural crest cell, then you're automatically part of the APUT family. Is it clear? So for example, odontoblast also comes from neural crest cell. Is it part of the APUT family? No, because it doesn't make any hormones. So just because it comes from neural crest cell, it's not automatically part of the APUT family. So only if you make the hormones. So those are the follicular cells, they surround the colloid and they make T3, T4. Surrounding the follicles, outside of the follicles, we have the parafollicular cells. They make calcitonin and they do not stain with the H and E because they're part of the APUT family. They will stain, or better said, impregnated with the silver impregnation. So hormones, T3, T4, who makes them? Follicular cells. What is the purpose for T3, T4? Basal, metabolism, heat production, and development, right? So it's very important processes. Without T3, T4, you wouldn't be you. You wouldn't be the intelligent you, at least, okay? So typically those babies whose thyroid gland is not working, or maybe, I don't know, the nutrients is not very good, you see mental retardation because of this, because T3, T4 is very much needed for your development and for the heat production. Who regulates the secretion of T3, T4? Well, your pituitary, right? It makes TSH. And who tells pituitary to make T3, T4? Sorry, who makes pituitary to make TSH? Your hypothalamus, by releasing TRH, right? So How is it working? Hypothalamus makes TRH. TRH works on the anterior pituitary, so it can make TSH. TSH will go all the way to your thyroid gland. Thyroid gland will make T3, T4. As T3, T4 increase their concentration, negative feedback system, right? So you stop the production of the TRH, you don't make it anymore. Calcitonin is made by the parafollicular cells. And what does it do? It lowers the blood calcium level. So it kind of cancels out the action of the osteoclast. It inhibits your osteoclast activity. Can hypothalamus regulate parafollicular cells? Absolutely not. So what regulates parafollicular cells? Calcium level. Calcium level regulates it. So if calcium is too high, your parafollicular cells, take a look, where are they? They're right next to the blood vessel, right next to the blood vessel. So they have this ability to sense the calcium concentration. If calcium is too high, that's it. Off we secrete the calcitonin, and we can lower the concentration. Okay, you remember colloid, right? So the milky substance here that we use in order to make T3, T4. What is inside of it? Inside of it, we have a protein called thyroglobulin. Thyroglobulin is an iodinated glycoprotein. And what do we use thyroglobulin for? We use it to make T3 and T4. So this is like a precursor substance, like a very long chain that your follicular cells just cut. And as they cut it, they make T3, T4. So thyroglobulin is not a hormone. It's not. It's just a protein, an iodinated protein, right? And if I cut it, and on that substance I have 3 iodine, right? I have 3 iodines. You call it T3. If you have 4 iodines, you call it T4. So that's the only way that you need to know. Everything else is important for physiology, but next semester. As I noticed, even though it's in the book, they don't ask about the exact process of making T3, T4. Okay, so it's next semester physiology, you'll talk about it. So here's your follicular cell. This is the colloid. Within the colloid, you have thyroglobulin. Thyroglobulin is iodinated glycoprotein, so it's somewhere here, right? So what is your follicular cell doing? Just taking this thyroglobulin and just starts cutting, just cutting to make it into the T3 and T4. Then absorb this T3, T4 and put it into the nearby blood vessel. That's how it looks like. So let's do our slide. So thyroid gland. Immediately, how do I know? Because I can see follicles. Do you see? All of those structures, they are follicles. Each little tiny circle, this is a follicle. Let's magnify to it. So this is a follicle. This is also a follicle, right? So there are lots and lots of follicles. What is this pink tissue inside? How do you call it?
Colloid?
Colloid. And what is within this colloid?
Thyroglobulin.
Thyroglobulin. Okay, so inside of it, you're going to see thyroglobulin. Is thyroglobulin a hormone?
No.
No, it is iodinated glycoprotein. What do I use this thyroglobulin for?
Formation of T3 and T4.
Very good. To make T3 and T4, right? So to make T3 and T4. How do you call the cells which are outside of the follicle, which are kind of lining the follicle? What are they?
Follicular cells.
Follicular cells. So each and one of the cell, this is going to be follicular cell. Do you see there is this whitish area, right? This whitish area indicates that this is the place where you have taken out T3 and T4 from. Think about it this way. It's like follicular cell took a bite from here, just took a bite from this colloid. It used this colloid to make T3 and T4. So those whitish areas are just indications for that your colloid is being used right now, that your follicular cells are using it, right? You can see some blood vessels here. Those blood vessels are your fenestrated capillaries. They're super huge here, super big. And then right next to them, you can see some pale cells. What are those pale cells? Those are the parafollicular cells that they make calcitonin, right? So those are the parafollicular cells that make calcitonin. Of course, parafollicular cells could not be seen with H&E very nicely because they are part of which family?
Deep.
Apute. Okay, they're part of the apute family. What does apute stand for? Amine precursor uptake and decarboxylation. So what do I need in order to see them? I need silver impregnation. So this slide is silver impregnation. It's not actually H&E. So follicles, and you can see between the follicles some kind of cells. What are those cells?
Paracellular.
Between the follicles, some kind of cells. What are they?
Parafollicular.
Parafollicular cells. So we magnify, those are the parafollicular cells. You can clearly see them, part of the apute, because silver impregnation, right? Parathyroid gland. Parathyroid gland is within the thyroid. It's kind of embedded within the connective tissue of thyroid gland. And we have 4 of them, 2 superior and 2 inferior. So they're within the connective tissue of the thyroid. It's lobulated. Connective tissue is very evident in adults specifically, but the amount of connective tissue keeps increasing with age. So the older you get, the more connective tissue you have. So eventually it will constitute more than 60% of the entire mass of the parathyroid gland. Two cells are present. There's the principal or chief cell, and there's the oxyphil. Principal or chief cell is the most numerous one. It has a kind of like a pale staining, sometimes eosinophilic staining, and it is the principal cell. So it does the most important thing, which is making a hormone. Which hormone? Parathyroid hormone. Parathyroid hormone is the opposite of calcitonin. So if those cells, parafollicular cells, make calcitonin, what is the purpose of calcitonin? To lower the calcium level, to lower it. PTH will do the opposite. Parathyroid hormone will raise the calcium level. So what does PTH works on? It works on osteoclast. It activates your osteoclast, right? Epithelial cells or renal tubules as well, and etc., etc. Oxyphils have no role. Okay, so have no secretory role. We call them supporting cells. Nobody knows what exactly they do. So here's your parathyroid gland. Okay, so oxyphils are reddest. They're the ones which are the reddest. And those pale looking cells, those are the principal chief cells. So those are the principal chief cells. They make PTH, and the red ones are oxyphils. No function. Nobody knows what's the function of oxyphil, just some kind of supporting function. Okay. And lastly, we have suprarenal glands. They are on the top of the kidney, right? So that's why we call it suprarenal gland. Another name is adrenal gland. Here we have inferior vena cava, and this is abdominal aorta. And have you seen this meme? That this is Rose and this is Jack from Titanic. They're holding each other like this. Okay, once I've seen this meme, I cannot unseen it. I cannot unsee it. It's definitely true. This is the Rose, which is just standing in front of the Titanic, and this is the Jack, which is standing behind. So inferior vena cava and abdominal aorta. Different vessels from different societies, so definitely not meant to be together. So yeah, this is your adrenal glands right here, witnessing it. Parenchyme of the adrenal gland is very special. It has the cortex and it has the medulla as well. Okay, so there is the cortical area and there is the medullary area as well. And they look different. And because they look different, that kind of tells you that they come from different places. So cortex of adrenal gland comes from mesoderm, and medulla will come from neural crest. And agree with me that this is an endocrine organ. So medulla will have which kind of cells? Which family will they belong to? Hmm?
Yeah.
Neural crest
Rapid-
cells making hormone. Repeat.
The apute family.
Apute family. Okay, so you're going to see that within the medulla, you'll see some cells, and they will definitely belong to the apute family because they do come from neural crest cells and they make hormones. So they will come from the apute family. So before we go further, we need to talk about the blood supply of the adrenal gland because it's very, very special. So adrenal glands are supplied by three vessels: superior, middle, and inferior suprarenal arteries. Those arteries are going to be entering the capsules, and as they enter the capsule, they give you a branch, right? So the capsular artery, and that's when it starts to kind of divide. Your adrenal gland, specifically the medulla, right? The inner part of the adrenal gland has a dual supply. It's very important to know. It has a dual supply. What does it mean? So let's follow. This is my capsular artery, gives me an arteriole, some kind of cortical arteriole, right? Which becomes, I don't know, capillary. Capillary will become venule, and venule will become vein. You can see that the first supply of medulla of the adrenal gland is a venous blood, right? It's a venous blood. But I don't want it. I want arterial blood. So that's why there's another branch, okay, which we call medullary arteriole. And medullary arteriole also arises from capsular artery, but it fully traverses the cortex. It doesn't give any branches in the cortex, just its destination is just to come to the medulla. And once it comes to the medulla, it supplies this medulla with the arterial blood, right? So it's going to be supplying this medulla with the arterial blood. So as you can see, your medulla has dual blood supply. The venous blood supply, which comes from the vessels here, right? So we call it the cortical vessels, the cortical capillaries, they will become veins, and those veins will supply the medulla, right? But there's also arterial supply, and this arterial supply comes from the medullary arteriole, okay? That kind of traverses the entire thickness of the cortex and just comes here. Okay, speaking of medulla, medulla has very important cells. They're called chromaffin cells. Chromaffin cells belong to the apute family because they come from the neural crest cells and they make hormones. Which hormones do chromaffin cells of the medulla make? They make norepinephrine and epinephrine, or another name, adrenaline, or another one is noradrenaline, right? So epinephrine and norepinephrine are made by the adrenal medulla, specifically the chromaffin cells. It's very important to know that chromaffin cells are epithelioid cells. They're not just epithelial cells, they're epithelioid cells. What do you need to know about epithelioid cells? They are partially neurons and partially epithelial cells. Basically, they are neurons that make hormones. That's what it means, epithelioid cell. It is a neuron that makes hormones, okay? That's what epithelioid means, okay? Okay, cortex has 3 layers, and I kid you not, you're gonna see those 3 layers every semester from now on. All of your internals, all of them, 3rd year internal, 4th year internal, 5th year internal, all of the internals that you'll have, we'll talk about this, the adrenal cortex. So make sure you learn it very well. 3 zones are in the cortex. The most outer is zona glomerulosa, then fasciculata, and then reticularis, right? Deep to the reticularis, we have medulla. What is within the medulla? Chromaffin cells. They make epinephrine, norepinephrine, whatever. Percentage, important, right? So the thickest zone is fasciculata. So let's talk about the first one. The first zone is called zona glomerulosa. zona glomerulosa consists of tightly packed cells. The cells are columnar or kind of small cuboidal, and those cells are arranged into clusters or columns. So you see them very, very much close together. And what do you make within the zona glomerulosa? You make mineral corticoids. So the cells here, they make mineral corticoids. What is the mineral corticoid that they make? It's called aldosterone. Okay, so aldosterone will be made here. What is the job of aldosterone? To absorb sodium, right? So it regulates sodium, so it absorbs sodium from the urine, and water will follow as well. So it kind of manages the homeostasis of sodium. So it's very important that your sodium goes back to your blood. So your urine does not just get it out. So you don't just excrete the sodium, okay? You have to reabsorb it back. So this aldosterone will be working on the kidney, so the kidney can reabsorb the sodium. Okay, so zona glomerulosa, mineral corticoids, aldosterone, that's what they make. Fasciculata. Here the cells are large, polyhedral, and it's very important to know that here cells sometimes have two nuclei. So don't be afraid to see it, okay? That they have two nuclei. Like here, this is one cell, it has two nuclei inside of it. So it's very normal, binucleated cells. Lots of cholesterol they also have. So those whitish area, those are the lipids of cholesterol. How are they arranged? They're arranged into columns. As you can see, sometimes they say cords. So into columns or cords. That's how the cells are arranged here. What do they make? They make glucocorticoids. So not mineral corticoids, they make glucocorticoids. Which glucocorticoids specifically? Well, cortisol. And everybody knows that cortisol is a stress hormone, right? So for example, fun fact, the reason you wake up in the morning, the reason why you wake up, your cortisol level rises, and more glucose is available to cells. So cells start to be active, your neurons start to be active, so you wake up, right? So the reason why you actually wake up is because of the cortisol. And then zona reticularis, that's the deepest area. Okay, so cells are much smaller, and what do they make here? They make this DHEA. What does DHEA stand for? It stands for dehydroepiandrosterone. That's what they make. What does dehydroepiandrosterone do? It's a precursor for your estrogen and testosterone. So it's very important to know that not only your ovaries and testes make testosterone and estrogen, your adrenal gland can also do so. It can also make a precursor and then use this precursor to convert to estrogen and testosterone. Okay? Fun fact, not important. So just basically the idea behind is that your blood vessels reach medulla very well. Okay, so there's literally a blood vessel between your zona fasciculata and your medulla. Why is it important? The cortisol has to reach the medulla very fast. The more cortisol you have, the more epinephrine you will make. Okay, so you're more aware of this. So there's like a direct blood vessel that connects them. So let's do the slides. So here is your adrenal gland. So outside of it, you can see the capsule. There's lots of capsule. This is the cortex, and this is the medulla. And you can see that medulla is quite bloody because epinephrine and norepinephrine, they need to get places. So the medulla is super, super bloody. You can see that there is some kind of fat around your adrenal gland. This is perirenal fat. Maybe from last semester, you remember we kind of talked about it, right? So this is a perirenal fat. It's the fat around the kidney. So your adrenal gland is kind of embedded within that. What are those? Those are actually brown adipocytes. So don't forget that brown adipocytes have a very specific location. They're not present everywhere. So those are the brown adipocytes right here. So everything else is white, but some places are the brown adipocytes. Okay, so that's the brown adipocytes, right? So multilocular adipocytes. Right next to it are the white. This structure is a ganglion. Okay, so this is a ganglion. That's where you see it. Sometimes they ask, it's very unfair, but they do. Ganglion is like a nucleus, but it is in the peripheral nervous system. So do you remember supraoptic paraventricular nuclei? What is nucleus? Nucleus is collection of cell bodies, a bunch of cell bodies of neurons. This is called nucleus. But where exactly? In the central nervous system. The same idea in the peripheral nervous system has already a different name. We call it ganglion. So this is a ganglion right here. And those are the axons of those cells. They're coming in to synapse with your chromaffin cells. Do you see? They're going to the medulla. They're synapsing with the chromaffin cells. So you can make more adrenaline and noradrenaline. Okay, some blood vessels, not important. So let's do it. So this is the capsule, okay? What is the first layer?
Zona glomerulus.
Glomerulosa. Next one.
So-
Fasciculata. And next one.
Reticularis.
Reticularis. And this is the medulla. Okay, so this is the medulla. Which kind of cells are in the medulla?
Acute.
They part of the acute family, but how do you call them?
Chromaffin.
Chromaffin
cells.
cells.
Yes, yes. So those are called chromaffin cells. They make epinephrine and norepinephrine. Some blood vessels as well. Again, capsule. This is the zona glomerulosa. You make here mineral corticoid such as aldosterone. Zona fasciculata. Okay, you can see that they're kind of in columns, right? Some kind of columnar-like structures. This is the place where you make glucocorticoids such as cortisol. And then the last one is zona reticularis. This is the place where you make weak androgen, weak precursor for the sex hormones, such as the dehydroepiandrosterone, right? So DHEA. And a little bit of the medulla is here. So that's your medulla, okay? So those cells, they are chromaffin cells. So maybe it's worth mentioning that chromaffin cells are a bit triangular. Why are they a bit triangular? Because they're epithelioid cells. Epithelioid cells are typically triangular, right? So the neurons that make hormones, we call them epithelioid cells, right? So those, what you have to remember here. And our slide here, we just see a bit more precise, the divisions, right? So this is going to be your capsule. This is going to be your zona glomerulosa. So this is going to be the fasciculata. This is going to be reticularis, and this is your medulla. So the layers are very visible here. You're done? Okay, so that's it. Stop sharing, stop the recording.